Next contestant in this category, the business division, is Norm Furbush of Syntervention. Please welcome Norm to the stage.
Thank you. Good evening, ladies and gentlemen. Thank you, Sharks. Thank you, Springboard and Wesleyan College for having me here tonight. My name is Norm Furbush. I'm the president and founder of Syntervention. And my vision is to reduce the amount of contamination that goes on in a hospital these days. And we've invented a few products, and I'm going to discuss that tonight. I only have about 6 minutes. I'm going to get through it as fast as I possibly can, but I'm going to be available for questions afterwards out front. So let's just go ahead and start it up. So our company history, we were founded in September of 2010. We commercially launched a couple of products. And we have a number of accomplishments that all small medical device companies go through. Our first problem that we identified was accidental device contamination. So accidental device contamination means that when a medical device becomes unsterile, so either it falls on the floor or during the actual procedure it gets contaminated and becomes unsterile. And it can happen due to a number of things. One, due to physician training. It can also happen because of the procedural area is really small, or it can actually be just based upon the device design. And actually what happens is the actual patient pays for it, so we want to try to eliminate that. We all want to reduce healthcare costs. So these are some of the products that we came up with. They started out as a drawing, and then they became a CAD drawing, and then they actually became a prototype, and then they all been filed for patents. So the second problem is that fiber contamination. So a lot of people don't realize, but we wear clothes every day, cotton, right? And so we use cotton manufactured products in their procedures every day. And cotton manufactured products actually have cellulose in them. So the cellulose, if it gets into your body, can actually cause a granuloma, adhesion, a thrombus, or a number of myriad of complications. So it's actually a recognized problem in the healthcare community and pathologists, and it's a very significant problem. So just basically a 4x4 gauze or a Telfa pad, these are some of the culprits, and just wiping off a medical device will cause this problem. Here's a couple of pictures I've just quickly show you guys. There's gauze fiber on the wire, there's gauze coming down the wire, and there's actually a piece of gauze stuck to the stent. So we actually have a solution for that. We actually have, it's called a swiper. It's an ester-based polyurethane foam wipe. And as you can see, it conforms around the medical device when we wipe it. And the really nice thing about it is it's environmental, meaning that this is 50 gauze, this is one swiper, that's all you need for one case. The second product that I want to talk about in the fiber contamination product lineup is the actual cotton towel. So we lay a lot of medical devices, as you can see right here, on top of a cotton towel, and cotton towels have fiber and lint on them. So what happens is when we lie those on there, obviously it attaches to the device and then it ends up in the patient. So we actually came up with another product called the swasher, but just if a hospital actually just use this basic tool right here, it's just a lint roller. And I dreamt this up at about 12:15 at night one night. But you can just take a lint roller, roll it across the towels that you actually have in your hospital, and you can see the fiber and lint on there. It's really simple. So the swasher is our next product. We just launched it last month. It's an ultra-low lint surgical towel. So the next problem, so I had a dilemma here. Not everybody's going to buy into the towel market. Not everybody's going to buy into the swiper market. And so I needed to come up with something that was going to be a fiber barrier, but also a device that was actually going to keep everything on the table. So the next product is called the gutter. This is not out yet. These are prototypes, but we are ready to go. And it's actually designed to actually hold the medical device on the table, as you can see right here, and also prevent it from actually touching any of the towels or any of the fiber or linty products that we use. Here's just a couple of the configurations that we have that you can cut it into any length that you want. So when I walk into a hospital as a sales rep, because I'm the #1 sales rep right now, they're going to ask, well, how can I benefit the hospital? How are we going to save money here by adding more money to the procedure? So I can actually walk in and go through the numbers, so we can take like a total cases of 1,000. The accidental contamination rate, say, is about 20%, and the average device cost is about $100. So if they spend $15 with us, we'll save them about $5,000. And then there's also a time factor, as you can see. So just to go retrieve another device adds to about $36,000. So we can actually save the hospital a total of about $22,000. So the market size, it's about 5 million interventional cases a year. It's 15 million diagnostic cases and about 54 million surgeries. So there's about 1.5 million surgeries going on a week. So our customer base is obviously anybody that uses a cotton towel or any kind of cotton-based products in their procedures. These are just some of them, but there's literally hundreds of procedures going on. Cost of potential complications, as you can see, hospitals are obviously concerned about people coming back after they've had a procedure done, and these are just some of the numbers that are out there. So it's pretty expensive. That's why healthcare is up there. Marketing, we're doing all the marketing that obviously a regular medical device company would. I have professional relationships for 30 years, brochures, websites, social media, medical advisory board, and medical device trade shows. Our product distribution is, we have a fulfillment center in Denver, Colorado, so we use that. Our first global account will be in Singapore. In our sales strategy, we use distribution. We don't currently have a sales force, and we'll use webinars for training. And thank you very much.
Thank you very much. Norm Furbush, Syntervention, and now to the judges for their questions.
Wonderful presentation.
Thank you very much, sir.
I'm going to ask you a couple questions. Real quickly, how many have you sold so far?
How many of
Well, let me ask you, you've got two products, Swiper,
Yes, sir.
Swasher, right?
Correct.
So how many have you sold?
Swiper was commercially launched July of 2012.
Okay, Swasher?
Swasher just 2 weeks ago.
Okay.
So I haven't actually sold any Swashers yet.
Okay, what's your price point for the Swiper?
The Swiper, we box them, they come in 3 different kinds of cases. So they come in a case of 100, and they come in a 1-pack, a 2-pack, and a 4-pack. The 1-pack is $295, the 2-pack is $495, and the 4-pack is $795.
That's $295.
That's correct, $295, right, for a case of 100.
And what's your cost to produce?
We have very good margins on that, I can tell you that.
Okay. That's a secret.
I think everybody.
I'm representing the over 50 crowd.
Do you have patent protection on these inventions? And
okay.
Is it easy to copy them?
For the Swiper and the Swasher, we have contracts with the companies, exclusivity contracts for those 2 products. They're not patentable, okay? I got those. I worked on getting those devices from other companies, and then we did a fair amount of testing to make sure that, let's say they were biocompatible, we could actually register them with the FDA. So there's a fair amount of testing that has to go on before we can actually take it and bring it out to a patient. So there's a whole quality system that goes along with Syntervention. There's a lot of moving parts. We probably need a couple hours to talk about it. Mm-hmm. So
are hospitals getting lint on their devices right now?
Yes, they are.
And they're okay with it?
So that's a great question. So there's visible lint and non-visible lint. So the lint, let's say on the Swiper, okay, it's about 30,000 particulate or fiber for that device on a gauze, okay? And for a Swiper, it's about 6,000. So there's a significant difference in the amount. But it's about 10 microns. A red blood cell is 10 microns, so we can't see that. But we lose it at about 40 microns with the human eye. So we can't see the particulate all the time. But you saw in a couple of those shots I had, we identified it because what's happening is when we wipe off a guide wire, the device that's coming down it is actually snow plowing the gauze down the wire so that we were able to see that. Does that answer your question?
Yeah, thank you.
And then on the surgical side, if you're doing an open case, right, and we put towels all over you, during surgery, the fiber and the lint actually gets into your open wound. So fiber and lint are really bad. My goal is to change the standard of care with these products. That's my goal. And in regards to, I think part of your question is we have about 25 accounts in the U.S. right now, okay, that are getting the Swiper. And then they'll get turned on to the Swasher. and then we'll keep moving forward. And I've already completed the Singapore registry for the first global account.
Norm, I thought it was interesting that you worked in the field and kind of have developed a better mousetrap after 100 years of using gauze and what have you from our discussion earlier. What protects you and helps you grow your client base if it's not patentable? And by that I mean, is it a price point differentiation? How do you grow it and protect it?
Well, I could say being first, right?
Right.
Okay, so we could start with that.
There is no competition. Right
There isn't
now,
any
you're saying.
competition right now for the swiper. There's another company out there that has it's not an ultra-low lint towel, but it's a low linting towel, but I've already tested it, and there's a lot of lint in it, actually. I was surprised. So being first, obviously, is, the way to go. So we can look at it like this. There are a number of medical device companies out there that have a guide wire. So guide wires are all over the place. They're like $15 to $300, right? And they all have different things. And I'm sure that we're going to get some competition. But I'll be honest with you, that's probably a good thing, because we need to fix this now. We need to fix the problem. Because the healthcare costs are just climbing. And these are just simple things. And what we've done is we haven't evolved. So we have these fantastic medical devices today, right? But we haven't looked at the smaller things, like the fabrics, or the tools that the doctors have to use. I see these guys struggle every day. I was in the OR yesterday in York, Pennsylvania, and it's a struggle. So all the tools aren't there. So this is just part of it, just part of Syntervention. We've got a lot more to come, but I wanted to start in this arena to get some notoriety.
How will you market your product?
Sure. We have a brochure that we've created, and we actually put the product in the brochure so the person that's looking at the brochure can actually touch the product. I think that's really unique. I don't know a lot of companies that do that. So I think it's important. We also use social media. We have Facebook and LinkedIn. We have a great website with a lot of education on it. So anybody here can jump on and you can see what the contamination problem is, and you can learn about it. Because we just not enough people know about it. I'm going to use YouTube in regards to, like tonight when we're talking, we'll put that up. And then I'll be doing some narrations on the presentations that I have, and we'll get that up. So we're just going to keep going. And then I have a medical advisory board of 20 physicians and nurses.
So your customers are physicians in hospitals?
That's a great question. It's all over the board now. A lot of the hospitals have driven a wedge between the medical device companies and the reps and the hospital. So you have to do a lot of things to actually get into the hospital. So you do sell to the physician. They buy into it, right? They think it's a problem. Then you have a whole bunch of committees that you have to go through. So it's not just straightforward. In the old days, yeah, you could, the doctor said, hey, I want this, it's in. But today, it goes through a process. Yep.
And once you sell the product, you basically have to go in and change the processes inside of the institution that you sold it to.
That's
right?
correct, yeah.
How do you
Once they're turned on, the hospital's on. It's a commodity type product. They just reorder, every month.
So you have to have a training team to train people on their processes.
I would say that I've been more successful going in and doing a big presentation for a group of people than just trying to drop off something. Does that make sense? Because then you create the awareness, And a lot of people will say, hey, we don't see a problem, because you can't see it. You see it afterwards, because of one of the complications that are shown about this. Actually, the first reported fiber issue was back in 1949 on a baby. And we have lots of peer-reviewed journal data, describing this problem.
Has that fiber been a big cause of the infections?
It does, yes, sir. It does cause infections. Mm-hmm. Yep.
As I asked Brian, how would you use the funds should you win?
How to use the funds? I'd launch the gutter right away. It's ready to go. It's prototyped. I can have the company making them. We have to obviously package and sterilize them, put a label on it, get it in a 275-pound pressure box. All these things are important, when we ship stuff, and get the gutter right out. It's ready to go.
30 seconds for any other questions.
Very impressive.
I did have one final, is it a
Yes, sir.
contract-driven business? In other words, once you get into a hospital or work through a rep, are you guaranteed sales for a certain amount of time?
Yeah, until they switch up, I would guess, the way we sell product is we use a distributor. So,
So you would contract with the distributor?
that's correct, yep. And we pay the distributor a commission. Yeah, but it's actually a lot cheaper than going with a full sales force. The numbers are pretty staggering.
Didn't you say you had contracts with certain hospitals?
We're already in hospitals, yes, sir. We're already actually, changing the standard of care in institutions right now.
Norm, thank you.
Thank you all very much. Have a nice evening.